refractive comparison of the MOPTIM MRT-200, the 2-Win, and the Retinomax. We turn it on here. At this point it's in Chinese. We rotate it this way or this way, we get a +6. From +6 we can rotate and go all the way to -12. Let's go back up to that +6 again, and we'll take a look at see what the viewer's side is. We'll flip this so that it's supposed to cover this eye.
Okay.
Now go ahead and gently gently turn it yourself.
Alrighty. Let's try. Right about there, yeah. Right
now, look carefully at the E's.
Uh-huh.
There's 10 lines of E's. How many lines down can you still make out the shape of the E's?
1, 2, 3, 4. Probably 6.
6 lines.
Yeah.
Excellent. Great job. Other way, other way. Now, there you go. Now, slowly, slowly, slowly go. Can the tops go clear now?
Wait till it's clear.
Now, how about the bottom? Is the bottom one pretty clear?
Yep.
You did great.
No, that's fine. We're taking pictures.
Nice.
Nice.
Get it back right about this distance. Nice.
Okay.
Great. Opter. Right about there. Now gaze at the big letters and relax your focus. Perfect. That let you focus on me, and we're going to now look at a distance. We're going to count to 5. 1. Did you get a little bit clearer?
Yeah.
All right. Now try a smaller letter. Can you see that one?
Hmm?
Or with 5. This one. Good. You've got excellent vision. If the patient has astigmatism, we notice certain of the clock hours get clear first, and then the perpendicular clock hours get clear later. Like that side. All right, perfect. Now everything is blurry for me, but I can hold it. All right, and then I'm going to slowly turn it like this. And now I see the 330 line is clear. And what power is clear for the 330 line?
+3/4.
All right. Now I'm going to turn it more. And now the 1230 line is clear.
Okay, so now you're at -1.
I could see 6 lines down. What I'm looking at that's pretty clear. For patients, we had non-routine adult, young adult, and young pediatric patients who were proficient at using a phoropter, and some were even able to guess cylinder with the MOPTIM device. There were 219 total, of whom 206 had all devices tested. There was a wide racial ethnic mix. 58 had developmental delays, and this number were able to complete all the testing. This is a demonstration of bland Altman plots of MOPTIM, 2-in, and Retinomax against actual refraction, measuring the vector components J0, J45, and spherical equivalent. From this, we get these data for the bland Altman, showing with MOPTIM MR-200, 2-in, and Retinomax, right and left, a very good correlation for all of them between actual refraction and the devices. On the other hand, 2-in and Retinomax were better at judging astigmatism. For over minus, both the MOPTIM near device and the Retinomax monocular near device over minused significantly more than the 2-in. When ABCD ellipsoid single metric of spherocylinder was used, comparing medians, we found that there was a similar median between Retinomax 2-in and the MOPTIM device. However, the means were a bit less accurate with the MOPTIM, and the distributions were different. When the ellipsoid is compared for MOPTIM, 2-in, and Retinomax against the ellipsoid gap, in other words, the degree to which the eyes uncorrected would be blurred, there was a very similar amount between all the devices for 206 patients. On the other hand, when we took 61 of the most blurry patients, more than 5 ellipsoid gap, the 2-in and Retinomax were closer together, and the MOPTIM did not estimate refraction as well. For one subject who did 20 test-retests with the ellipsoid on right and left, we found this degree of match to the actual refraction, which was at least better than the ellipsoid gap for that subject. When visual acuity is tested, right and left eye, using the MOPTIM and the internal tiny vision chart versus M&S with actual refraction, the correlations were fair with an ICC of 0.41 and 0.47. This shows the actual refraction data, medians comparing MOPTIM with actual for all 175 patients who were compared, and also on the right for 41 who had minimal refractive error. We found the MOPTIM MRT-200 to not be as accurate, especially with cylinder, compared to the Retinomax or the 2-in. However, it was capable of rapidly estimating sphere visual acuity improvement over a wide range. Thank you.